So my name's Ross Sutherland. I chair the board of the Ontario Health Coalition. Some of you may know Natalie Mayer, our executive assistant. Executive director. She's in Kingston tonight, so we're sort of sharing duties here. And with me tonight is Angela Priocannon, right? Close, Angela?
Close. Priocannon.
Priocannon, thank you. She's a vice president of ONA, and she'll be speaking second. I'm just going to do a few introductory comments, and then Angela's going to take the discussion specifically about what's going on in Clinton and at her own perspective. Then we'll open up the floor to questions that you've got and comments that you've got. And thanks again, everybody, for putting your speakers on mute. You just have to remember to take them off. By this time, I think most of us are getting at least a little bit used to Zoom calls. Anyway, thanks again. The Ontario Health Coalition is holding these meetings across the province. We're doing about a dozen before Christmas, and then we're going to do some more in January. Because we are facing a truly unprecedented crisis in our hospitals. I mean, I think we're all hearing about it, virtually every news broadcast. This summer and past summer and fall in Clinton and across the province, we saw hospitals close their emergency departments and ICUs, close beds, birthing units, and other services because they can't staff them. And this is really unprecedented. I mean, if you think about, I've been a registered nurse for quite a long time, and I'm retired now, and Angela has been also. I'm sure we all can think of times when we've had staffing shortages in our workplaces, but I've never experienced anything like, 100 temporary emergency department closures in a matter of 6 months. It's quite stunning what is happening in our hospital system. Yeah, every large hospital in the province is running at close to 100% capacity, up to 100 or more, up to 120%. And what that means is that every bed is full. Normally, hospitals should run about 85% capacity, because that means they have surge capacity in case there's a really bad accident or, you get something happening. But our hospitals now, like I say, are running 100% or more. So people are waiting at stretchers in hallways and lounges in every available space. They're just waiting for beds because there aren't any beds. And by this we mean a bed that's staffed and in operation, because without staffing, a bed is just a piece of furniture. And the reason I say that is that in some hospitals we have beds. It's just that they either can't find staff or they won't make funding available to hire staff. The backed up emergency departments are also backing up into the ambulances, where paramedics have to wait for hours because there's no staff in the emergency to offload their patients. And I'm in a rural community myself, and we experienced that very directly, because our ambulances were short an ambulance anyway, all get tied up in Kingston. So literally there's nobody out here. And I know our volunteer fire and rescue people are now seeing more and more medical emergencies because there is nobody in the ambulance sector, paramedics, to come out and get them within a reasonable amount of time. And recently, the pediatric hospitals have been thrown into crisis also, and they're redirecting children to adult hospitals, which are also not in a good situation. So this situation is far from normal, and it's completely unacceptable. And while we're paying good attention to it now, this is a problem that has been a long time coming. And, the Ford government says money won't make a difference, but this is totally untrue. And I'll come back to that in a minute. Across Ontario, we have the fewest hospital beds of any province in Canada. That's the fewest per capita, fewest hospital beds per person. And Canada as a whole is at the bottom of every industrial development country, third from the bottom in the number of hospital beds. We've had the most radical downsizing of public hospitals of anywhere in a developed country, and almost anywhere in the world. We are now the lowest of the low. In turn, the smaller hospitals have lost services as governments have forced downsizing. Local services have been cut and closed, centralized to larger hospitals, or rationed across multiple sites. Patients now have to drive from one hospital for rehabilitation to another one across the county for palliative care, to a different one for birthing services or surgery or tests, etc. The fact is that Ontario funds our hospitals at the lowest rate of any province, and this is on purpose to force them to downsize and ration their services. What has been staggering to the Health Coalition is how little the province is doing to resolve the crisis. I mean, yes, we've had a pandemic around the world, and it's taken a brutal toll on hospital staff, but Ontario is extreme. And to make matters worse, in this year's budget, hospital funding is going to be cut in real dollars. It's a small cut, but they're actually going to have a real dollar cut, not just a percentage cut. And there are many measures the government could have taken, which would have been easy in the short term. They could have scrapped Bill 124. That's the wage suppression bill, which kept nurses' pay and other health professionals at 1%, capped their increases at a time, especially now when inflation is running quite high. It's really a slap in the face and an insult, as well as creating hardship for those workers. They could have opened unused acute care beds, hospital beds, and fund operating rooms to full capacity, which they haven't done. And while money is not the only solution, it is an essential part of the solution, and these changes can't happen without increased funds. The government's plan is to privatize the hospitals. In the election campaign, they said, leading up to the election campaign, they said that they were going to privatize surgeries and diagnostics from local hospitals. We challenged them, they denied it, then they started to say, nope, we didn't say that, we didn't say it. And that's what went down in the media. However, as we've just discovered in recent financial records, they doubled the funding of the private for-profit clinics in the 3 months leading up to the election. So at the same time they were saying they weren't going to privatize, they were doubling the funding to the private clinics. And what is this privatize? And then after the election, they announced more serious plans to privatize. And what does this mean? It means that the profitable services, the surgeries and diagnostic tests that for-profit companies can make a profit from would be taken out of our local hospitals and handed over to private clinics. For places like Clinton, this plan would further take scarce funds and resources away from local public hospitals and shift them to for-profit clinics. The for-profit clinics are located almost exclusively in large urban areas where there is a market of wealthy people for whom they can pay extra to the clinics. Within those urban centers, for-profit clinics tend to be located in the wealthiest neighborhoods. For-profit privatization of our hospital services takes away funding and resources from the public system, and is particularly a problem for smaller, rural, and northern communities. In Clinton, as in other communities, these local hospital services have been built by the community over 100 years. People have donated, given in their local taxes, donated through payroll deductions, volunteered, and in many cases, literally built their local public hospitals. Ford's plan would dismantle this, taking the profitable services out of the hospitals and handing them over to private companies. And this privatization, privatizing our public hospitals and failing to address the staffing crisis are twin issues. When you privatize, you take staff out of hospitals, you don't grow staff on trees in private clinics. So we just spread them out and we just take them away from hospitals. Move on to a discussion about what's actually going on in Clinton and what's been happening with the nursing staff, and then come back to talk about what could be done in the community. Angela is a nurse for 20, how many years, Angela?
Actually, 32.
32 years. She's
and
worked in surgical thoracics, head and neck, urgent care, and home hemodialysis, and worked in St. Joseph's Healthcare in Hamilton. She's the first vice president of the Ontario Nurses Association, and she's working with the nurses in Clinton about some of the issues they're facing there. Okay, Angela, the floor is yours.
Thanks, Ross. And just for everyone's information, I wish, Ross, you mentioned that I was retired like you. I so wish I was retired. But,
what did I say that? Sorry, I mentioned that.
You kind of mentioned that we were both retired, and I wish I was in your shoes for sure.
Yeah.
Hi, everyone. I'm really pleased to be here tonight and to speak. Thank you, Ross, and the Ontario Health Coalition for organizing this important town hall. My name is Angela Creel-Cannon, and I'm a very proud RN and the first Vice President of the Ontario Nurses Association. ONA represents over 68,000 nurses and healthcare professionals across the province, including 18,000 nursing students. I'm grateful to be here with you today and to have the opportunity to share what is happening in our healthcare system now and why we know privatization is not the answer. At this point, anyone who's paying attention has heard it before. Our nurses and healthcare professionals have been stretched beyond the breaking point. We've been in crisis mode for almost 3 years now. At some point, it is not a crisis anymore. It's actually the new reality. And we all know that this cannot be our new reality. We know from the Canadian Health Institute for Health Information data that Ontario is the worst in the country when it comes to RNs per capita. Across Canada, there are 830 RNs per 100,000 people. In Ontario, we have just 668 RNs for 100,000 people. That means just to be at the Canadian average, Ontario needs to hire almost 25,000 RNs immediately. What does a staffing shortage of this magnitude look like in practice? It's become commonplace for nurses to be kept at the hospital for hours after their shift is supposed to end because the next shift is so short-staffed, it's not possible to safely transfer patient care. We have nurses in areas where they require 35 nurses on a shift, but the new normal is 17 or 18. We have a hospital where there's more RN vacancies than there are RNs on staff. For months now in Huron, Perth, ONA members in emergency departments have been calling on their employer to hire more casual nurses to staff the emergency departments and to keep their doors open. In fact, over 500 people in the community have sent a letter to the hospital CEO asking him to listen to nurses and to hire more casual nurses, and he has refused. As a result, the workload pressure is unrelenting, and we've seen temporary emergency department closures across the region due to staffing. You can take action now. And if you go to our website, www.ona.org/HPHA to send your message. We need to keep up this pressure because we need more RNs to staff the emergency rooms. Long wait times and cuts to home care mean that patients coming to the emergency department are there to receive the care they should be getting at home. It's putting more strain on an overburdened system. We know that nurses are resilient and resourceful. We always put patient care first. Even in these extremely difficult times, our members find ways to provide the care they know all patients need and deserve. But the cost of this burden is taking its toll. Early retirements are going up. New grads are rethinking their careers and leaving only after 1 or 2 years on the job. Nurses are leaving to work at private agencies where they can ensure they have a work-life balance. This is a very real cost to our healthcare system as the situation worsens. And now the full picture is coming into view. The Ford government is setting the stage to use this crisis to justify their privatization agenda. Ford took an understaffed system and made it so much worse by introducing Bill 124, which caps the wages of many nurses and healthcare professionals, violating our charter rights. Ford is refusing to work with healthcare professionals to invest and implement a meaningful retention and recruitment plan, leaving our system severely understaffed with no relief in sight. And now Ford is using this crisis, which he has created, to push his plan to privatize our healthcare. Across the country, Canadians pride themselves on world-class universal healthcare systems. We believe that access to healthcare should be based on your needs, not on your bank account. Nurses and healthcare workers are strong advocates for public, nonprofit healthcare because we know the devastating impacts of privatization. The most broken parts of our healthcare system are the ones that are already privatized, like long-term care and home care. Private healthcare will take away from public healthcare by pulling resources and staff from the public system. As nurses, we have already seen this as colleagues have left the public system to go work for private agencies. And we can't blame the nurses who make that choice. The agencies let nurses choose their own hours and pay more. Conveniently enough, they are not subject to Bill 124. But there's a serious cost. Those agencies charge outrageous prices to our public hospitals. They don't provide pensions, benefits, or sick days for their nurses. This undermines nursing as a stable career and undermines our healthcare system by siphoning off precious dollars to line corporate pockets. This will impact access and quality care, and it will hurt patients who can't afford to pay. We can't let this happen. Ontario's public healthcare system is not Doug Ford's to dismantle and sell off to his corporate buddies. Our public healthcare system has been built up over generations and belongs to all of us. And that's why the Ontario Nurses Association is here with you tonight and will continue to work hand in hand with our allies to fight for the investments we need in our public healthcare system so that everyone gets the care they need and deserve. Together, we can stop Doug Ford's plans in its tracks. Thank you so much.
Great. Thank you, Angela. I'm still a bit shaken about that. I just don't know how. I hope everybody else is doing okay. It's very difficult at this long distance over Zoom to do a check-in. We will do our best to make sure that person is blocked from other calls, and I just wanted to apologize again. We haven't had a lot of bombings for these events, considering they're very open and public, and which is great because that's what we like. But I guess that's the risk that we also carry. Anyway, I'd love to open up the floor now to hear what questions you've got and what comments you've got. And I've been sort of tracking a bit what's going on in the hospital, and Angela, I know, has been working with some of the nurses there. But if somebody could give us an update on what's happening in the emergency, and then if you've got, please just ask your questions and make your comments.
I'd like to just make a comment about what's happening with the Huron-Perth Health Alliance. Because the hospital, as I said, is refusing to hire casual RNs in the emergency department. The nurses there have been working on a campaign since January, and I've been working alongside with them. We've been able to engage the board of directors, and on Thursday evening, we've been invited as guests to speak to the board of directors to let them know that the CEO and that the hospital is not amiable to having casual RNs who could keep those emergency departments open. But the hospital was refusing this. So we will be meeting with the board of directors. I will be speaking, and I have 4 nurses from the department who are going to be speaking and telling their story to the board of directors, with the hopes that they will come forward and make a recommendation and provide that ability to have those casual ED nurses so that they can keep the emergency department open for the community.
Yeah. Great. I think that's so important. I just want to say too that in terms of getting nurses to come back, the Canadian Federation of Nursing Unions came out with a report, and one of the strong recommendations they made is that we need flexibility to make sure that nurses who've been retired, if they want to come back, if there's ways to make them, let them work a shift here, a shift there, 2 shifts. That's one way to cover the shortage, rather than being really strict about the rules. Work with the nurses and the Nurses Association and create an environment where people can work what they can and give what they can back to the system. So that's it's good that you're taking. I'll be interested in hearing what comes out of that meeting.
I'll be happy to report back that if they give us the casual ED nurses, that would be an absolute bonus. But I'll be happy to report back to the coalition and let everyone know. If
you would like to speak, just either speak up or at the bottom there.
Yes, I would like to know. I would like to know, what is the hospital's excuse for not hiring casual nurses? What is their excuse? They always have one.
Angela?
Well, from my understanding, they didn't feel that it was necessary, and they didn't want to, they didn't want to comply with requests. So we have nurses that have decided that they wanted to work elsewhere, but wanted to stay in at Huron-Perth Health Alliance as a casual staff. And they just refused. No rhyme, no reason. And in fact, when the pressure was starting to mount, the employer said, oh, well, we'll have casuals everywhere else but the St. Mary's emergency department. And, that was one that has absolutely had some trouble with having the employer agree. So now they're taking positions in Clinton and in Seaforth to try and get casual positions. I would love to ask one of the guests on our call tonight if he would like to speak to it. John?
Well, thank you. I am a registered nurse in rural healthcare and have been for many years. And I do see the challenges that you talk about, Ross. We talk about, or I've heard talk about these big departments that have many nurses working in them, while ours are all skeleton staff. There's only 2 ever at best. And you get one out that's on a transfer with someone, and you have someone else come in that's deathly ill that needs to go out, and you're the lone nurse there. And if there was casual nurses available, it's somebody else that you could at least call in. But over my course of years there, I have seen many nurses leave, not by wanting to leave, but because their employer has refused casual positions. They're fully trained for the emergency department, fully trained for the inpatient units. It's just sad to see. There's nothing to lose. I mean, we have a clause in our agreement that says if somebody does not pick up a shift within 6 months, then the employer has the right to let them go. But for some reason, they just anything to make it more difficult. We're constantly being asked to do more with less, and what it comes down to is it's jeopardizing your safety as a patient out there. Mm-hmm. That's what it comes down to. So I'm glad to hear the board is willing to hear from the Nurses Association at an upcoming meeting. It's sad that the CEO hasn't listened to his own staff. It really is. It's sad that other senior management haven't listened to the floor workers to say, here, this is what we need. This is what we think can help. But the bottom line is it affects you and your care. Also puts our license on the line as well as a professional body. But it comes down to you folks, and you're going to be affected. And I don't mean to sound, that the world is ending and put panic out there, but there's times that does occur, and it occurs more than what you think. So sorry, Angela, I kind of talked in a roundabout way, and I just don't want to get into too many specifics, but I'll turn it back to you, Ross.
Yeah, no, thank you very much for that, John. What other questions do you have or comments?
What can we do to force his hand to do something about this?
We'll come back to that, Marianne. Shelley, and I have actually got a response to that. Shelley?
Okay,
yeah.
Thank you.
Hi.
Where are you?
Yeah, sorry. My question, I guess, I seem to have gone. Can you hear me okay?
Hear you just fine. Your picture's gone though.
Okay. So my question, I guess, is what support are you getting from the medical doctors? Are they banding together? Are they concerned about the staffing levels? Is everybody a team?
I don't know if Angela or John can answer that. I can answer it in a general way from other hospitals, but I don't know the Clinton example well enough.
Well, certainly we've seen, and I can't speak specifically about the Clinton doctors myself, but we have seen many physicians, particularly emergency physicians, coming forward and speaking to what is a crisis. And, our government continues to deny that there is a crisis. And in fact, don't want to panic the public, is their words. They don't want to panic the public. But we have to be cognizant of the fact that this is a huge crisis. This isn't something that was just because of COVID. This was a long-standing underfunding structure that has created this. And, doctors have come forward from the emergency departments and are quite vocal on social media about what is the government not hearing? Why are they not reacting? And they're putting pressure on the government themselves. So, they are speaking on behalf of their nursing colleagues and their healthcare professionals that work alongside them to try and influence. But we're only, we keep having to do it. You have to just keep pushing and pushing and pushing.
Yeah, by and large, doctors especially in smaller communities really want emergencies to be open for a whole series of reasons. Many of them like working there as a break from their family practices. So they've got family practice, they have emergency. For them, it's a growing and it's a career, sort of it's a work life, it's enjoyable thing for them. It makes a better environment for them. They like to have the ability for their patients to get care in their communities. So they've been very strong advocates. Like the Perth Hospital, where I'm located next to, the emergency doc there is probably the strongest advocate. He's been in papers. He's been pushing all the time to make sure that emergency stays open. Because the other thing that they also know is that if the emergency goes to an urgent care clinic, there is really no such thing as an urgent care clinic. It just becomes a walk-in clinic. And then that starts to jeopardize the hospital, because hospitals, meet the definition of hospital, need emergencies and they need laboratories. And once those start to become marginal, the long-term funding and structure of the hospital is actually in jeopardy. Yeah, Vanessa?
Hi, everyone. My name is Vanessa Salverda. I am actually a nurse at Clinton Hospital. I work in the Emerge department. And I just wanted to mention that in regards to our doctors and the kind of support that they give us, they are 100% behind us in every aspect. They voice their concerns when it comes to staffing shortages. They are behind us 100%. So we have no concerns in that aspect at all. So they've been wonderful.
Yeah. Other comments there? Or questions that you've got? What can be done? Well, there's a bunch of things that can be done. And I think the first thing to think about is that this isn't just a problem of your local hospital administration. Sure it is. In one sense, I mean, legally, Angela and the Ontario Nurses Association are going to go and talk to them and try and talk some sense into them. But as much as there is no direct control from the province over these hospital corporations, to think that they don't have significant control is wrong. So you gotta wonder, since this is happening across the province, the government has actually cut the funding to hospitals this year. I think they're telling these local managers, especially with the smaller hospitals, we don't mind, if you manage to get rid of 2 or 3 of those emergencies, that's okay. Just take your time. They're not going in and saying, you keep that place open or you're going to lose your job. We're going to put you into you're going to bring in a supervisor. They're not, giving them the tough backroom talk. They're actually, I think it's quite reasonable. And I expect that at some point in time when we can get access to the appropriate documents, we will see that they have been sort of, fine with this and almost encouraging it. And I think that that's a really important message to get out and talk to your local MPP about. Because for small communities, having a hospital is great. Well, it's sort of almost essential for keeping the population there, for getting jobs to come in. It's a crucial economic driver. And it's obviously crucial for people's health, and it creates jobs. So, you've got to talk to your MPP. So that's one thing. And the second thing I would say, and I'd be interested if people would be interested in volunteering, if you have it, I was asking at the beginning, I don't know if you've had any public meetings there about bringing people together to talk about what you can do to support the hospital. I know you've got a foundation which basically raises money, which is great, but you need a public advocacy group that's prepared to challenge and demand answers and say, we want a full service hospital here as much as you can get in a small community. So we want a functioning emergency, not one just from 8 till 6, but we need a 24-hour emergency. And we need a functioning lab, and we need functioning diagnostics. And, if there were people who wanted to help take that on, we would, as a provincial organization, would be happy to work with you. We have worked in many small communities to save emergencies, to save birthing units, save hemodialysis units. It doesn't always work, but it certainly works sometimes. And part of the what makes it work is when you've got a good grassroots community. So if there were people who wanted to either write their name and phone number in the chat box, or send a note, in a personal note to myself, or Sala in the direct message box, we'd be happy to get back to you and talk about what that would mean, and what we could do to help. And then I think if you had an organization like that, you all of a sudden start getting into the local papers, you get on TVs, you talk, you just start to build a campaign, and you work with the nurses, and OPSU, I'm sure, has probably got members there, and you work with other members, you work with the business community, and to say, we really need this. We need this in our community. So I think those are the things that can be done. One is start making it clear that the government is sort of letting this happen, and we can't let that happen. So that's your own MPP is your starting point with that one. And then secondly, making sure you've got some sort of local group of people. And even if you don't get a local group, you just do it as individuals, but it's stronger if you've got a few people who are talking together and doing a little bit of strategy here. To say, we really want the emergency to stay open. We really want a functioning hospital. It's important to our community.
Well, my name's Ron Garland. I live near Kincardine, which has had several emergency room closures in the
Hi,
last
Ron.
several months. Chelsea's the same, Walkerton's the same. And my question is, why did we highlight Clinton? Why not Seaforth? Why not Wingham? Has there actually been talks with somebody about Clinton actually being privatized?
Okay.
The CEO of the Health Coalition categorically says there has been no conversation, and there never will be. Is this a trial balloon that's been floated in a safe conservative riding? My MPP would be a waste of air to talk to her about doing anything as far as healthcare goes. So my question is, why Clinton? Has there been something happening there that we don't know, and the Andrew Williams is not talking about, or his board of directors?
I think that it's safe
So
to
go
say-
ahead, Angela. Yeah.
Sorry, Ross. I think it's safe to say that there's not one hospital in all of this province that's not at risk, whether it's a rural hospital or whether it's a big city hospital. It doesn't really matter. There is a belief that the government has intentionally created such chaos and this crisis to force privatization, because their belief is that people will believe that there's no other option but to pay. They keep saying, oh, no, don't worry. OHIP will cover everything. Nothing's privatized. We're just thinking of innovative ideas. Innovation means privatization, any way you want to slice it. So to be clear, Ron, thank you for the question, but I do not believe that anyone is safe. So has anyone spoken
To answer my question, please, why Clinton? That's the one that hit the headlines of this Zoom. That's the one that perked my ears up when I heard it. And I'd like to know, has there been talks about privatizing Clinton in particular?
No, I can honestly say I don't know of any, but we've had meetings in Chesley. We've had meetings in Perth. We actually have been consciously going to small hospitals where emergency services have been significantly reduced. And the reason for doing that is the history in Ontario and around the country is that when small hospitals, emergency departments start to die, it eventually means the end of that hospital. And that's our concern. These hospitals are important. They've been built by communities, and there's no sense waiting until, you know, you get the notice that the doors are shut. You want to get in there, especially when you can see the pattern over what's happened over, well, decades now, of how to get rid of smaller hospitals, because the government doesn't like them because they tend to cost a little bit more. You know, they have to do extra things to keep services in small hospitals. And part of the problem is that, you know, and I've done my work. I did some academic work on medical laboratories, and part of the problem there was that a lot of the small hospitals, the big laboratory companies, and in Ontario that would be Life Labs or Dynacare, they wanted all the community work, and so they went into small communities. They set up their collection centers. The government allowed them to do that. That work came out of the hospitals because the people used to go to the hospitals to get their blood samples done. And when it came out of the hospital, some of those labs ended up closing, and they cut back, and that hurt emergency services. It hurt services for inpatients. So you can see the process. And so we're not targeting Clinton in the sense of saying we have a particular thing happening in Clinton. What we're doing is we're targeting Clinton because you've got an emergency which is open from 8 in the morning till 6 at night. And I think that's still correct, isn't it? Yeah, that's correct. You know, so it's emergency, yes, but it's not really an emergency either. I mean, it's also been closed many odd days here and there. It's not reliable. And we're very concerned that this is actually the beginning of the end for the hospital, because it has happened that way in other parts of the province and around the country. I don't know if that answers your question, Ron. Okay, thank you.
We also are having town halls tomorrow in Seaforth and the next day in St. Mary's.
That's right. So we will have done all 4.
Right.
But they're not the only ones. We've got them all over the province. And
Yeah.
like I say, we are doing some of the big centers too, but you know, it's a different animal in Toronto or Hamilton or London, Ottawa, than in Perth or Clinton or Chelsea. I mean, it's just a different problem. And in fact, the problem, I think, are more severe in the small communities, where in fact you need the hospitals in a sense more, because they're a bigger part of the community. So I'd love to hear comments. If you've got any comments or questions. Marion, did that make sense as something we can do? Oh, you got yourself on mute there, Marion. There you go.
There, I mean, I went and helped QP do their protests. Was very proud when QP won their protest. And I'm telling you, we were 20 people out front of Lisa Thompson's office. And I'll tell you, I think we need 20 people every single day out in front of Lisa Thompson's office with placards, and maybe somebody will pay attention to us.
Yeah.
Period. I don't want to say anymore. I get too excited.
It does require some excitement and anger. Yeah.
And that's really key, is going into your MPP's offices, making an appointment to go and speak to them, writing those letters, getting those campaigns going, and, you know, asking them, what is your accountability to all this? Lisa Thompson's office, I wish I'd known. I would have come. Oh, man. I'm in Queen's Park all the time for question period. And there's some people that really make my blood boil, and she's one of them. And she doesn't even have to say anything. She just sits there all smug. It's just enough. But I have to tell you, it's very interesting to watch the debates that happen when a question period is happening, and when the government is challenged, when the majority is challenged on healthcare. It's the same reel over and over. They just keep repeating the same reel. And so you know then that they really are not listening to the people of Ontario.
Colleen Garland here.
Yep.
If you say they're not listening, then why are we not listening to the fact that they are not listening? I don't think that you're going to get any place by talking. You're going to have a bigger stick than that. And the way that we look at Lisa Thompson is exactly the way that we look at a lot of the other MPPs and Doug Ford. We are not going to get a lot by just simply saying, poor us, please help us. Ain't gonna work. We're gonna have to do something more, come up with something more.
Did you have any particular idea?
I don't think you'd like to hear it.
I would. I think we should start protesting her office every day. Downtown Blythe, every day at 10 a.m. We can spend like an hour and get to know one another, drink some coffee,
Okay.
and show up. Someone be there every day till we get some answers and something done about it.
Yeah, thanks, Marion. Andrea?
Ross, I just wanted to point out you have a whole bunch of questions on the comment section.
Oh.
You were asking if there was any questions. Well, there's quite a list.
There's some, I look at them all. Somehow I lost them in there. What services are most affected at the parent? Do full-time nurses going casual actually reduce the available staff? Less total hours involved. I don't know. Do you want to address that, Angela? And yes, I do get that becoming a casual nurse may be what keeps a nurse in the profession. Does the board have any power to make changes? Angela?
Well, full-time nurses, or people that go to casual, are usually trying to find some work-life balance. So it often is the case that they need a break. They still want to stay in the profession, but they just need to find that sweet spot. So does it actually reduce the available hours? Not necessarily. It gets them to pick their hours that they want to work. And so in some cases that is helpful. It is also helpful when, as John pointed out, two nurses in an emergency department and one leaves on a transfer. If you have that ability to call someone in, that's a casual, that will come because they are committed to that community. They're committed to their community. They're the people that are serviced in that community. They're committed to the people they work with. So those are things that, casual is often a way to just give themselves a break and stay in the profession. Does the board have any power to make changes? Well, let's wait and see. The boards generally have recommendations, and when they feel the pressure from the public, then, they hopefully will act on it. And so we're hoping to have a compelling case to present to them about the need for the casual staff to keep the emergency department open. Because as Ross explained, if they're not open, they're not servicing the public, the community in which they're in. And that's really important to the board as well. It's very important. They don't want it closed.
Yeah.
I hope that answered the question.
On the casual nursing thing, I think it also works very well at the other end. And that is that nurses who get older, for a whole series of reasons, they don't necessarily want to work full time and they don't want to work full time shifts. But they're still quite happy to work some shifts. And creating that flexibility, especially in communities where people tend to retire, allows people to come in and help out in the hospital who've got lots of experience without having to take on full-time staff. The next question is there enough funding and are there enough nurses to fill the jobs? Two questions, and it's important to separate the two. The funding question is, no, there's not enough funding right now. And the government has to make the funding available. There is enough money in the government. We've had multiple reports now from the auditor and the Office of Financial Accountability, which say this government is actually not spending the money they had allocated for healthcare. They didn't spend all the money they got from the federal government during the pandemic. They are just not spending the money. And this is a political problem. This is where putting pressure on your local MPPs, even if it's people who you think are impervious, they know and they take it back to caucus. And people around them know, and you're changing the public opinion. This is what it becomes a political problem. So you have to figure out ways, it's not you, but we all do, to just really keep the pressure on. And that's part of what these meetings are about. So there's money there. It's just that they're choosing not to spend it on healthcare. So that's the first thing. Second thing, are there enough nurses? Well, that's a good question. Certainly when you've had restrictions on nursing increases for 4 years at 1%, there's a bunch of nurses who said, well, either I'll go and work in a private clinic where, you know, I don't have to work nights. You know, if I'm not going to make much money or not going to get raises that keep me going, I'm going to go and work someplace where the conditions maybe aren't so bad. You know, I can work, I don't have to work weekends. I can just work 8 to 5. And, you know, so that there's other nurses who retire. They just don't stay. They feel, you know, literally disrespected and they want to get out. So, and then there's a whole series of things that the government is not doing, which could increase the pool of nurses. And we could go into those if you want. But you know, there are some short-term solutions which can improve the number of nurses available, but it takes money. And then there are some long-term solutions that aren't being done.
And with the nursing shortage, it is out there. It has been there for decades.
Yes.
It's just been exacerbated by the pandemic has seemed to really showcase it. And as Ross said, we've had nurses leave prematurely, retire prematurely because of the workload, the amount of violence they're seeing. These are the things that have driven nurses away from the profession. It is increasingly more difficult to go home at the end of your day and say, I feel good about what happened today.
Mm-hmm.
So that's one of our main retention issues. And of course, Bill 124 did not help at all. So that has been a huge, huge issue. We just are not feeling respected. We're not feeling empowered by this government. And so we need the public to step up and to come forward and pressure the government to say, you need to save these nurses. You need to save these hospitals. You need to have the staff to do the work.
Shelley,
Yeah.
and then I'll continue with the questions in the chat. I'm so glad somebody pointed that out to me because I had missed them entirely. I was watching the faces. Shelley?
Yeah, where is the government at with Bill 124? Because, you know, obviously with CUPE workers, that wasn't brought up. So what's happening with healthcare? Are you still under Bill 124?
So for the Ontario Nurses Association, we're going out of the moderation period as of March 31st of 2023. We are going into bargaining in January. And so we will be hopeful. We also have a charter challenge that was heard in September about Bill 124 and its constitutionality, because it is a female-dominated profession, felt that it was unconstitutional to target women. It is not just nurses, of course, it's any public sector workers, with the exception of police and fire that were in this. I do know that SEIU, the healthcare division, is now going into the start of it. So the results of the charter challenge won't be known for a few months. We did present a very strong case. It's 2 days of hearing. So we're hopeful, but, you know, we're hoping that the government will not put us back in for another 3 years, because that wouldn't be unheard of to have the government do some crazy things. But certainly we are hopeful that this we've done our time, and now it's our time to be able to bargain freely and openly.
Good.
Good. There's a question here. It's my understanding from hospital staff, I know that they're not allowed to talk about the staffing shortages. I haven't heard that specifically. I know that there are some home care companies where they sign clauses that they can't talk about what problems in home care. I don't know if Angela, if you know of any situations in hospitals where nurses aren't. I mean, there are restrictions, obviously, confidentiality regard to patients. But is there an actual restriction on nurses talking about working conditions?
Well, no, because patients see it. They see it and they know it. They feel it. When you're not able to get to them in a timely manner, they know that there's a problem. Have nurses been disciplined? I can't speak to that. Certainly, employers look at different ways of making sure that you aren't saying much, but I haven't had that experience. It is very concerning though when we are just told to just keep going and not have that support from the employers. That's really concerning. The CNE, or the chief nursing executive of every hospital, ought to be an RN. It's not always the case from what I've heard lately, but that is the most responsible registered nurse in the building, who is as accountable as we are about the care that's given to our patients. And that's something that we have to look at. Like, everyone that provides care and has that regulatory body licensing is responsible to ensure that we meet timely standards and give appropriate care. So, oh heavens, I hope that Bill 124 doesn't exist forever for everyone, but that's where we are right now.
And it may be just, in any workplace, and hospitals, I don't think are much different. Management has a significant amount of control, and if they feel that you're making it difficult, there are things they can do to make your work life difficult. And so it may be that there are certain managers in certain hospitals that make it more difficult for nurses to speak up, or other health professionals to speak up. And that's always a concern, because you really want, and frankly, I think if you want to improve the healthcare system, you have to be able to hear what people who are working in the system think would make it better. And without that kind of a discussion, we actually can't make it better. So you have to encourage people. You really want people to speak up. And so it's unfortunate when they don't. Yes, if we hear of any particular threats to the hospitals, we will let people know. I think, just from my understanding, the two that are most a threat are Clinton and Chesley, and that's just because the emergencies seem to be a long-term cutback. And like I say, there's a little bit of a tradition here. There's a history of when emergencies start to become dysfunctional over time. It eventually, it could be a year or two. The hospital is sort of, they're looking at the hospital. Do they really need to keep this as a fully functioning hospital? So that's just something which I would say, there's a bunch of other comments here.
I wonder.
Yes, shoot, Carolyn.
I wonder if we could point out that other provinces are doing something to help out. Quebec offered to hire 10,000 nurses, and they got almost 8,000 by doing that. BC is working on healthcare. These provinces do have money, and if they're pushed to shove, I think they use the money. So I think what we need to do is point out that other jurisdictions are in the same problem, have the same problem, and they need to do something about it.
Okay, thank you. There's a question here. Can we provide guidance on what to say in a letter? That's a good question. I don't see why we couldn't. I think what the most important thing to say is we want the government to make a firm commitment that the Clinton Hospital will stay open, and that their intention is to bring back full-time hours for the emergency, and a commitment that funding is coming. I think that's a way to make it very concrete to your community, and that's a significant part of the issue. So we to sort of put a point on what you're asking for, which is that you want the emergency to be there, and start to make that the cry, and that there should be a public commitment and to come from both your MPP and the Minister of Health, and ask them to do that. Our nursing staffing vacation, are the vaccination clinics? I don't think that the vaccination clinics, I think they've all gone back to, oh, you mean, are they working in the vaccination clinics? I don't think so. I don't know. Angela? No, that's public health nurses, really. They have their own, I guess if you wanted to close public health, you could, but it's not a good idea to close public health. That doesn't help hospitals very much. You just have a lot more people getting sick. Angela?
I don't know there. I mean, when we were at the height of vaccinating, we certainly had nurses that were taking casual positions to work in vaccination clinics versus casual at the hospital to work full time in a vaccination clinic. So, but I don't believe that there are hospital nurses that that are solely working in those situations. In bigger communities, like the community that I'm from in Burlington, they certainly had many nurses, but most of them were public health nurses that were hired by public health. So
yeah, that's right. There's a question here whether OPSI, which is the union that represents the technologists, I gather there's a technologist on here. Hi, MB. Are they active? Yes, they are active. In fact, we were supposed to have an OPSI speaker here tonight, but they had to cancel at the last second, and they've been speaking at other ones of these town halls. And they've been quite active and supportive in the campaign. So your voices are being heard. And it is true, I think, in the general public debate that it's mostly nurses and PSWs. But, you know, you can't run a hospital or a healthcare system without, you know, people running x-rays and lab techs and running all the machines. So that's it, equally as important. Without naming someone, I want to know. Okay, I don't think. Okay, so that's all the questions in the box. Are there anything else? Other comments that people would like to make, other questions? If there's anyone, like I say, I will put out the offer again. Yes, Ron?
Yes, is this a conservative problem or is it an Ontario government problem? We've said it's
I think
back a
it's
few years, and let's cut to the bone here. Who's really to blame? Is it the
Yeah.
Ontario government or is it a conservative ideology problem?
It certainly started in the mid-90s with the Harris government. And that's when the big cuts happened. I don't know if, I mean, many of us, I think, are old enough to remember that they laid off, gee, I don't even remember the number now, but tens of thousands of nurses in Ontario. And then they had to hire them all back because basically the hospitals ground to a halt. So, but in terms of funding, it's been since 95 to today, there's only been 2 years when there's been a real increase in hospital funding. And that was in 2016, 17, I think. So it's been under both governments. I think, you know, some governments are more ideologically opposed to public services. And I think they would be fair to say that's the conservative governments. So I think that's why we're facing so many more challenges right now. But we've had a long-term trend towards cutting funding in hospitals, unfortunately. Yeah, Nick?
Hi there. My name's Nick McGregor. I'm born and raised in Clinton, been personally affected by this, going to Emerge multiple times when it was almost closed and having to rush to there to try and get there. But I work with the here in Bruce NDP, and I just want to know how I can help push things with the official opposition to bring this more into the limelight. I've already spoken with potential leadership candidates about the crisis that we have going on here, but is there anything else that specifically nurses or people in the community would like to see that I can try and help bring about?
Well, I will say from the Ontario Health Coalition's point of view, you know, we're a nonpartisan group, although we've been pretty clear that we don't support the current Conservative government. So we're making no bones about that because they've been so terrible. I think for all the opposition parties, what we need is a consistent, and I appreciate both the NDP and the Liberals here very clearly. They've both taken very strong positions now in favor of expanding funding and in rebuilding the public hospital system. And I just want to say that part of the problem is not so much that we're going to see immediate privatization, which is going to close a bunch of hospitals. It's that we don't think what governments do is they see the solution as privatization. So they're not thinking, we're not going to privatize, we're going to figure out how to fix and make the public system work better. So we're going to put the money into the public system. We're going to do the changes that need to be made to make it work. And if you put your energy into that as a government, you put your policy people working on that, then you get changes in the public system, which make the system work. And basically for 25 or 30 years now, we've had governments which have not had that priority. They've been looking at all sorts of other ways to solve the problem, just undercut the funding, to find other solutions outside the public sector. And that's part of why we get to where we are. So and part of that is you got to keep the pressure on, and that's the job of the NDP and all the other opposition parties, is to keep that pressure on within their own party, so there's no flagging there, and make it a priority for them in the House, so that everybody's asking the questions, they're keeping the pushing going, they're coming out to the demonstrations, they're helping people write letters, they're doing whatever they need to do. Yeah.
Ross, can I come back and make a couple of suggestions about the idea of people picketing around their MPP's office?
Sure, Brian.
It's Brian. Yeah. So I think that's a brilliant idea, to be quite frank. And I think that what you should do is have as much fun as possible. We had one person, when we noticed there was a pattern of the MPP not coming to the office when our scheduled pickets were going to be there, we had one person appear in a chicken suit. And so not only did passers-by like it a lot, the news media picked up a story again, which adds more pressure. They're very susceptible to the pressure. We had somebody brought a barbecue and he fried Spam because they figured that the messaging from the government was in fact spamming the public. So like, if you can think of a gag, do it. It'll warm your spirits. It'll make everybody else more excited, and it will bring other people to do it. And it doesn't take many people walking around a building to make an obvious show. Don't just stand in front, because it's getting chilly for standing anyways. Walk around the block or walk around in front or circle it or whatever and make a show, pump your signs up and down and shout slogans. It has got to where our MPP deliberately avoids his office if he has any whiff of the fact that we're coming. And so then we can say, well, how is he accountable? He won't even talk to his constituents. So up the pressure on him. So for those people here who were talking about picketing, I think you need to like trade emails in the chat box here and organize that and go for it and have fun.
Yeah, thank you. Yeah, this is both a short-term and a long-term thing. We're going to have an election again in just a little over 3 years. So we're sort of planning for that now, but we're also trying to push now so that we get some increased funding that will help, that'll keep some hospitals open, that'll keep some emergencies open, that'll get more people hired. We want to, open up positions. We want to get nurses coming into the province, make it easier for them to get their training. PSW is the same thing, doctors the same thing. So there's things we can do in the short term, and then there's, part of it is a political campaign that we're developing, which is creating within the public this sense that we really need and value our public healthcare system and not letting that drift away. Anyway, are there any final comments? Judith, are you waving to say something?
Yes, I'm not sure which button to push to put a little red hand on the.
Well, if you go to the bottom, I'll just tell you it's reactions. But anyway, you're on now. Go for it.
Anyway, I understand that in the States, if you are registered as a nurse, you can practice in any state in the United States. I've also known from years ago some young nurses, one from BC, one from Grand Bend, who, when they cut down the nursing positions in their provinces, took off, went to the States adventuring, and worked down there. And they accepted the Canadian licensing. I'm wondering if it would give us a better pool of nursing if the licensing bodies would accept nursing qualifications that we'd consider equivalent, like across Canada, maybe across the States, maybe places like Great Britain. And also because nowadays, most families, you've got men and women both working, and sometimes one has to move someplace for a job, and you're more likely to move someplace where they can both work
And by leaving things more open for the licensing for nursing, it might even mean that we'll find that there's some people whose spouse has been transferred into Ontario, but their licensing is no good in Ontario, but they'd be perfectly happy to work in their trade. So I'm thinking that somehow opening up the licensing might help a bit.
I think you're right, and I think that the government should be onto that. Should have been onto it years ago. Angela?
That is something that actually the Canadian Federation of Nurses Unions is a union of all of the, represents all of the nursing unions across the country. They are pushing that at the federal level and asking for that ability to do that. It's not all states that will accept Canadian licensing. There are many, but it's not all states. And certainly you have to go through a process when you come to Ontario from the states to be able to ensure that you are able to practice here. But there is an exam. The NCLEX is the national licensing exam, and that is the same across the country. We used to have individual provinces had their individual licensing for the registration at the College of Nurses, but the NCLEX is something that's across the country. So they're a little bit more transferable because of that. But again, it depends on the province and the state.
Great. Thanks, Angela. There's one comment here, which I think might be a good place to start to wrap this up. Well, thanks. I learned a lot. I appreciate that. But is that this particular situation is a choice by this government. And our job here is to make that choice that they're making right now to undercut our public hospitals and our public healthcare system harder, and hopefully change their mind in at least in small ways so that we can, say what we can and build a better system. So thanks again to everybody for coming. It's been a great discussion. I'm sorry I didn't get to all the questions earlier, but we did find them. And if you would like some help doing something in your community, we're easy to contact through our webpage, which is the Ontario Health Coalition, or just send me a message before we line up here, and we'll get in touch with you. Okay. Is there any final comments from anybody? One new message. Great. Thank you very much, everybody. And good luck in Clinton. Yep. We'll be in touch, I'm sure. Okay. Bye-bye now.